Hello, everybody. I welcome you all to this program, which is called WISE, and which is the short form of WISE Insight into Seizures and Epilepsy, what parents and caregivers must know and ask. Today, we will talk on some issues regarding seizures and epilepsy. I am Dr. Rekha Mittal, and I will be joined by Dr. Saurabh Chopra, Dr. Rajni Farmania, and Dr. Rafat Trivedi, who are pediatric neurologists, and Ms. Satinder Walia, who is a clinical psychologist. So, just a little bit about seizures and epilepsy. So, our brain normally is full of electrical potentials which give rise to electrical discharges. And this helps the brain and body to function normally. But sometimes what happens is that these neuronal or brain cell electrical discharges become abnormal, excessive, and there is a sudden rise in the currents, which is conveyed to the body and gives rise to features like shaking, moving, different kind of features may be there, and these are called seizures. And what happens during a seizure depends upon which area of the brain is affected. And depending on that, it may present as impairment or loss of consciousness, some abnormal motor activity, sometimes a behavioral abnormality, some abnormal sensations, or the loss of function of some anatomical part of the body. Thus, there are many different kinds of seizures. So, what causes these seizures to occur? There are many different reasons. First of all, there might be metabolic events, which means that the biochemistry or the chemical constitution of the fluid surrounding the brain or inside the brain is changed. Or there might be a brain infection. Sometimes the drugs may be some drug levels may become toxic, or there may be side effects of drugs. Oxygen levels in the brain may be low, some head injury may occur, and sometimes seizures occur because of fever. So then what is epilepsy? If seizures start to occur without any of the immediate precipitating causes that I mentioned just before, and if these seizures occur again and again, then we call it epilepsy. So what causes epilepsy actually? If there is an old damage to the brain, or if the genetics is abnormal, then epilepsy may occur. So with this little bit of background about epilepsy, I would like to ask Dr. Rajni Farmania, how do you actually diagnose epilepsy? Are there any tests? What do you need to say that a child has epilepsy? Dr. Rajni, can you tell us something about that?
Yeah. So epilepsy, first thing is that epilepsy, to diagnose epilepsy, it's the clinical information. Basically, the diagnosis depends upon how the child is presenting, what events happened before, and what actually happened, the clear information of that event and what happened after that. A very good pointer to this, or a very good helpful tool, will be a video recording if we have so. And the other investigations that we usually do after an event supports the diagnosis. So diagnosis will be mainly on the clinical information which we get, and if it suggests epilepsy or seizures, then the doctor, as per the doctor, the diagnosis is made.
Okay. So once you start to suspect epilepsy, then most doctors will advise an EEG. So what is the role of an EEG in a diagnosis of epilepsy? I mean, why do you do it? What information does it give?
So EEG is electroencephalography. That is a, in layman term, I would say a brain mapping. You would put some electrodes here, and then you want to see what are the electrical activities over your brain. This gives us an idea about what kind of epilepsy the child has, if so, and that will also give us an idea that what are the drugs which we use best for that kind of epilepsy. some idea about the overall prognosis. Prognosis means overall the course of the disease and how will the child behave in future also is attained by EEG. However, if a EEG is normal, it does not rule out epilepsy. As I said earlier, that diagnosis of epilepsy is clinical. EEG in these cases might be, in some cases, might be normal. So EEG gives an idea to characterize epilepsy, but is not a whole soul marker which will suggest that it is to diagnose epilepsy.
So, but sometimes an EEG is done, and when the parents take the child to the doctor says you have to do the EEG again. So, why is that? What is the importance of a good quality EEG? Can you tell us something about that?
Yes, ma'am. EEG in epilepsy is a very important tool to understand the character and the prognosis and multiple other factors in epilepsy. So there are two problems which we face in EEG recording. One is either the EEG technical problems. It is not done properly because of some technical issues in that EEG machine or the settings. The second thing is the EEG protocol is not properly followed. Suppose the child had convulsion or seizure in sleep and only an awake EEG is done when the child is waking. So that will not give a clear information. So either the technical problem is there or a right kind of EEG is not done. And the third common thing is that the EEG reporting is not proper. So in that circumstances, sometimes we want to advise a proper EEG with proper technical settings and to give a more information about the kind of epilepsy. So that is the importance of good quality EEG, and that is the importance of getting a repeat EEG sometimes according to the case.
So, in addition to the EEG, the doctors often also advise an MRI for the child. So, what is the role of an MRI in the diagnosis of epilepsy? How does it help?
MRI brain is done to rule out any structural problem in the brain which can lead to epileptic fits. So it can be a small a congenital lesion by birth, or it can be some another issue which might be related to birth problems or some other de novo problems. So that it gives an idea that the epileptic fits is because of some structural issue or not. The other thing is that sometimes MRI is normal. So it gives us an idea that this structural etiology is ruled out. Now you want to work up some metabolic or genetic etiologies. So it gives an idea of clue that when and where to stop, what further investigations to plan after MRI. And sometimes the MRI also does not give a good information if it is not done in a proper setting. Like the MRI also has a good quality image. If it is not done in a proper, what to say, power, we want a 3 Tesla MRI usually in a case of epilepsy if the image quality is required in a good setting. The other thing is that if you do not have a proper reporting, then it adds to a lot of confusion. And sometimes some extra sequences are required. Suppose if a doctor suspects some metabolic problems, then they might require some extra sequences in MRI or some additional investigation in MRI only to get a repeat MRI.
Okay. So, but is the EEG always abnormal in epilepsy? Sometimes can an EEG be normal also and the child still have epilepsy? Is that possible?
Yes, ma'am. Scalp EEG is positive only in 50 to 60% of the cases. So that means that in around 40-50% of the cases, EEG might be normal. So as we have discussed earlier, that epilepsy is a clinical diagnosis. That means on the clinical grounds, only doctors make a diagnosis of epilepsy. Investigations such as MRI and EEG, it gives an idea that why this happened and how will this epilepsy progress further. If they are normal, then also the diagnosis of epilepsy can be made.
So, besides the EEG and MRI, are any other tests required or done sometimes, or just these two tests are okay and enough?
No, I have discussed, as you discussed earlier, that the etiology can be metabolic, like some amount of chemical change inside the brain fluid, which can lead to epilepsy, or some kind of genetic etiologies. So after the basic investigation, which is the MRI and EEG, you might say as a first line investigation, if both the investigations do not provide a proper guidance to a etiology, or it directs towards a genetic etiology, then we might need to get some blood investigations done, some urine tests done, and advanced kind of genetic testing also might be required depending upon the individual case.
You said genetic tests may be required, but very often the parents say that there is nobody in the family who has a similar problem of epilepsy. So, how can this epilepsy be called genetic? Why would we say that this illness is genetic if there is no family history?
Yes, this is a common scenario in OPD where we come across that the child is the only child, only individual in the family who has this problem. But here I want to impress upon that sometimes we do not take into consideration of the other extended family members, the blood relationship. In medical history, we want to take history at least of 3 generations. So sometimes parents do not have that clear 3 generation history of somebody having a epilepsy. The other thing is that the same family, if the child in the same family, if 2 or 3 people are affected, but they might have a different presentation of the same genetic disorder. So that is another problem. And the third is that in some family members, the parents may be carrier and the complete manifestation is there in the child. So parents are asymptomatic and the child has a problem. Even if everything is normal, like there is no family members who are affected, there is no other syndrome in the family, child can be the first person because there are so many new mutations happening in a generation. So we cannot say that if we have no family history, it cannot be a genetic disorder.
So, thank you very much, Dr. Rajni. You explained very nicely how we investigate a child with epilepsy. Now, I will request Dr. Rafat Trivedi to tell us something about what is the first aid and home management of seizures. So, Dr. Rafat, can you tell us how the seizures should be managed at home? What are the do's and don'ts? What should the parents be careful about?
Sure, ma'am. So sometimes what happens is when a patient, especially is diagnosed with epilepsy or having seizures, so what the first thing they do is they panic and call the doctor. And sometimes the doctors are not available to pick up the call. So the reflex reaction of calling should not be there, and the parents should be relaxed, the caregiver should be relaxed. The first thing that you have to do is, as soon as you notice that the child is having a seizure, you have to lay the child down and in a lying down position. So as shown in this picture, ma'am, can I have the next? This one? Yeah. So you have to place the child, you have to make the child lie down, keep a pillow or a rolled blanket beneath the head, and like shown in the picture, turn him or her to one side or the sideways positioning, and lift up the chin and the head a bit so that the airway is clear. So the aim is that the breathing should be okay and the respiratory passage should be okay. So you have to keep the child in this position till the seizure is going on. At the same time, you have to time the seizure. So if the seizure is lasting for longer than 2.5 minutes, then you have to give the rescue medicine or the emergency medicine that your doctor has prescribed in the proper dosage. So it is very important that we know the do's and don'ts during the seizure attack or during an emergency. So there is no need to restrain the child during these seizures. If the sometimes the jaw is very tightly clenched, the teeth are tightly clenched, so no need to do not force open the mouth, because if the child vomits during that episode, and if you try to force open the mouth, the tongue may fall back or he may aspirate the vomitus, and that can lead to respiratory problems, breathing difficulties, aspiration pneumonia, which can land up the child into emergency. So no forcible opening of the mouth if the teeth are tightly clenched. You should not be giving anything orally to the child till the child is completely conscious. Because again, in a drowsy state, sometimes we try to give water, they may aspirate and again develop pneumonia. The rescue medicine or the emergency medicine has to be prescribed. It can be used maximum for 3 times. But if the seizure is not getting control at the second dose, it is advisable to rush to the nearest emergency. So sometimes what happens is when the child is seizing, and we know that our doctor is, half an hour apart or 1 hour apart. There is no need to drive the child to the doctor, but you go to the nearest pediatric facility available so that the child can get timely first aid. Again, like Dr. Rajni said, that if there are two people and if you can make a video recording of the event and time the duration, it would be very helpful for your doctor to understand what type of seizure the child had. So there are still certain myths around epilepsy that the use of onion, shoe, keys, etc. can stop the seizures, but this is wastage of precious time and totally not advisable to do that. All the caretakers in the family, so parents, grandparents, nannies, or school should know what first aid should be given during a seizure attack. Sometimes some patients have seizures starting from one particular part of the brain, which Dr. Rekha ma'am also described as focal seizures. So they may get that pre-intuition or a feeling, like a feeling of fear, or sometimes some palpitations, or sometimes some weird kind of feeling, or dizziness or blackout. So if the child is indicating one of these things, you should be alarmed and you should place the child in a safe position or a rescue position to avoid any accidents. So we all know that small seizures, if infrequent, do not lead to much damage, and proper management is very important. So the child, the accidents during the seizures or mismanagement during the seizures are place the child at much more risk of, risk to life during the management. So home management of seizures is very, very important.
So, Dr. Rafat, uh, the midazolam nasal spray is very good for home management of seizures. But then, what is the correct way of using it? I mean, is there any particular technique, or what are the steps before you use it? Can you tell us something about that?
So, midazolam nasal spray is available in 2 or 3 different brands, and it is available in 2 strengths, which is a strength of 0.5 milligram and 1.25 milligram. Some sprays have 5 milligram and 12.5 milligram mentioned, but it is one and the same. So, it is very important to check the strength of the midazolam nasal spray once your doctor has prescribed, so that you get the same strength of the midazolam nasal spray. As you can see in the picture, there are these 3 parts to the spray. One is the bottle with metered pump, which has the drug. This is a nozzle with the tip, and there is a protective dust cap. So first of all, when the child is having a seizure, you should always be very careful, especially in febrile seizures or epilepsy. You should place the spray very handy so that you can find out, or anybody can find it out very easily. So you have to place the spray in this given position with your thumb down and your index finger and the middle finger on the nozzle, and gently shake the bottle. There is something known as priming of the spray. So there is a vacuum in an unused new spray which you have to release and spray the midazolam nasal spray about 2 to 3 times in the air. And after priming it, you have to put it in the nostril. So lift up the head of the child a little bit and put the nozzle inside the nostril and give the spray in the desired dosage in alternate nostrils. After a dose of spray is used, and if the seizures are subsided, you can just wipe it off with a tissue or a clean handkerchief, put off the dust cap, and keep it again in a safe place. The use of midazolam in children below 6 months or children with very low weight is not advisable, as we cannot judge the proper dosage in these children. While midazolam also comes with, every drug has its own side effect, and this can also have side effects like respiratory or breathing depression in young children. And so the use in infants or children younger than 6 months is not advisable. Now again, how to clean the midazolam nasal spray is you have to detach the nozzle from the metered dose, and you have to put all the plastic things like the nozzle and the dust cap in a warm water and soak it, and then you can rinse it in a running tap water. Dry it and then put it off. So this can be done every 2 to 3 weeks if you have very frequent usage, and the dosing would be prescribed by your doctor. So generally we prescribe it for different weight brackets, and your doctor would be telling you how much or how many sprays to be used. These sprays, as I said earlier, can be repeated at 2 minutes interval in case the seizures are not subsiding. In case the seizures are not subsiding with the third dose, the child should be rushed to the nearest emergency to get the first aid.
Thank you, Dr. Rafat. This was extremely important and useful information, life-saving information, in fact, for the parents to know. So we now move on to treatment of epilepsy, and Dr. Saurabh Chopra will be answering questions on that. So Dr. Chopra, does every child with epilepsy need long-term treatment? I mean, how do you work out which child needs treatment and how long the treatment should be?
So, as we all know, epilepsy is not really a single type of disease. The tendency to have repeated seizures is something that can occur due to various different kinds of neurological problems. That's why the treatment needs to be individualized in every child. And there are some epilepsies where seizures are quite infrequent and they are self-limited. Thus, in those cases, many times doctors may not even decide to start anything. No medications may be required, only observations and follow-ups may be required. Whereas on the other hand, there are epilepsies where seizures are frequent and there is a need to control them. Wherein the choice of medication also is individualized. It doesn't depend only on the type of epilepsy. It also depends on the child's age, his body type, whether it's a boy or a girl. So even with the same type of epilepsy, different children may be prescribed different medications. Can we go to the next slide, please?
So what happens sometimes is that treatment is started and the child still continues to have seizures. So what could be the reason for that? Why do seizures occur despite treatment? We see a lot of that happening.
Yes, you're right. We do see a lot of that happening. That is because our aim in treatment of seizures and epilepsy is basically to get good control of the seizures with minimal medications. So we always start anti-epileptic medications at low doses, and we start with the milder and better tolerated medications. That's why sometimes initially the seizure control may not be fully achieved, and the medications may have to be increased in their dosages or sometimes even changed, or additional medications. We may sometimes use 1, 2, or sometimes as many as 3 medications at the same time in the same patient to try to control the seizures. A very small percentage of seizures may be resistant to medications and difficult to control, and these may require further strategies beyond medications. And we'll discuss that later, hopefully, in this presentation.
So once these medications are started, how long do they need to be continued? I mean, typically parents are scared that, once these medicines are started, I mean, it will go on for many years. So is there any defined time period? How long do we give these drugs?
Yes, so that concept that medications once started for seizures have to be continued lifelong is really quite misplaced. So one has to first understand that epilepsy is not a single disease, as I had mentioned earlier, and thus it does not have any fixed course of treatment. In fact, the aim of medicines in seizures and epilepsy is to control the seizures. The medicines actually do not provide a cure. In fact, I would go on to add that even alternative medications do not provide a cure. But the good news is that most epilepsies, especially in children, tend to go away with age and the very fact that the brain matures and the child kind of grows out of their epilepsy. And that is the reason we have to give anti-epileptic medications for a definite period till the child actually grows out of it. Can I get the next slide, ma'am? Yeah. So as a rule of thumb, what we commonly use is that if we get at least a 2 or 3 year seizure-free period, we give a trial of gradual reduction of medications. The medications are slowly and steadily reduced in their dose, and we try to withdraw them. In fact, in some forms of epilepsy, which are self-limited, we may even try to withdraw them before this 2 to 3 year period. Whereas in other forms of epilepsy, for example, like juvenile myoclonic epilepsy, the treatment may have to be continued lifelong. So it does depend on the underlying type of epilepsy. But as a rule of thumb, if we get at least 2 to 3 years seizure-free period, most neurologists will give a trial of gradual withdrawal of anti-epileptic medications.
Okay. So a very common question that parents ask is that the treatment has been started, the child has had no seizures for 2 years or more. So can we say that the child is cured? Will he never have seizures again?
Right. So with children, the good news is that when a child is well controlled, that is 0 seizures for a period of 2 or 3 years, and we try to withdraw medications and stop medications, almost 70%, that is 2/3 of children will remain seizure free and never have seizures again. Whereas about 30 to 40% children, the seizures may return, but one should not lose heart. It doesn't mean that the seizures are never going to go away. It just means that the child is still not at a stage and the brain has not yet grown out of the epilepsy. There are some rare forms of epilepsy in which, as I had mentioned earlier, where medications may be required for lifelong. But for the rest, it's a very good chance that they will grow out of their seizures.
Another scenario that we come across is that a child has tried various medicines and still has frequent seizures. Sometimes one drug is tried, another drug is added, the doses are changed, yet the seizures continue. So what do we do with such children? What are the options for these kids? Are there any options other than medications?
Yes. So when a child doesn't respond to 3 or more properly selected medicines and continues to have seizure after seizure, the first step would be to reevaluate. Even the best of neurologists can sometimes benefit by reevaluating the child. We many times go in for better quality, highly dedicated MRI scans. We may go for prolonged EEG recordings where we try to capture the seizures so that we can be 100% sure of the type of seizure that we are dealing with. After evaluating, genetic tests may be required at this stage. And after evaluating properly, we try to find out the exact nature of the disease. And just by doing that, some children may be benefited by giving more specific medicines. In the others, at least 3 common options are used. One of them is the ketogenic diet, the other one being the vagal nerve stimulator, and the third, and in fact the most beneficial if the option is available, is that of epilepsy surgery. But as I've written in brackets, it can be used only in certain specific situations. So regarding just giving a brief idea about the ketogenic diet, it's a highly calculated and medically supervised diet. It should not be done without proper supervision. And in fact, one needs a properly trained pediatric neurologist or a neurologist who has experience with the diet, as well as a good dietitian to calculate and explain the diet to the parents. It actually is a specialized diet where we reverse the ratio of fat and carbohydrate, and this kind of makes the body produce what is known as ketogenic bodies, and ketones are supposed to then cause the metabolism to shift in a way that our own body produces substances that improve the seizure control and bring down seizures. Um, the other option, as I was discussing earlier, is that of epilepsy surgery. Here, epilepsy surgery can be done only in patients where highly advanced investigations can really zero in on a specific area of the brain that is giving rise to seizures. That area of the brain has to be sufficiently small to be removable by a surgical technique, and one should be reasonably sure that all the seizures are coming from that area. If that is possible, removing the area of the brain that is the real cause of the seizures can actually be curative. In fact, this is among the very few and only type of cures currently available for epilepsy. But mind you, it is to be done only in children where medications are not effective. The last option is the vagal nerve stimulator. It's a specialized device which is surgically implanted, but the surgery is pretty minor. And the device provides continuous repeated stimulation to the vagal nerve, which indirectly stimulates your brain. And this gradually over a period of many months can bring down seizures. Again, this device is expensive and thus is somewhat less commonly used in our country.
Thank you, Dr. Saurabh. You really beautifully explained different aspects of treatment for epilepsies in children. So now that Dr. Saurabh has explained what kind of treatments are available and required and can be given, I'll request Dr. Rafat Trivedi to tell us what the precautions are and what precautions should be taken while these medicines are being given to the children. Dr. Rafat, can you answer this, please?
Sure. So we have precautions regarding different things while the child is on medications. So let's see the precautions regarding the formulation. So first and foremost, you have to see what medicine your doctor has prescribed. So if we are giving, suppose for example, valproate. So if we are giving syrup valproate for the valproate, there are many brands which manufacture this sodium valproate. So important is that we stick to one brand and do not change from one brand to other. For example, you take Valprin for now and then Encurate for another, and so you should not do that again. Again, for tablets, you have different formulations like slow release tablets and the normal tablets. The slow release ones are also called as chrono or sustained release or continuous release tablet, which are sugar coated and should not be crushed. It has to be swallowed because crushing or breaking might lead to decreased efficacy of these medications. Also, if you're using a syrup, you have to shake it well before administering it to the child, because suspensions do have tendency, it gets the drug particles get suspended and you may get a fluid above, and so the initial dosage might be low while the later on dosage might be in the toxic range, so that can lead to more side effect or maybe an ineffective seizure control. So while taking a syrup, you have to store it in a given proper situation condition and shake it well before administering. For the dose, especially for the syrup, you should be using proper dosage. So if your doctor has written 3.5, So many dispensers or the caps do not have a marking of 3.5, and the parents say that okay, fine, I gave it between 2.5 and 5. So this has to be avoided for epilepsy medications, because we have to give the particular dose. So it is advisable to use calibrated syringes. So you have 5 ml syringes and 1 ml syringes for the drug dosage which are low, like 0.5 ml or 0.7 ml, etc. So you can use a calibrated syringe, draw that that particular amount of drug, and after using it you can wash it off and store it, and maybe replace it after a few days. Along with this, timing is also very important. So it is important to give drugs at regular intervals. So if your doctor has mentioned 12 hourly, you have to give it 12 hourly or 8 hourly. It happens many times that parents during the start of the treatment or something sometimes forget to give the medicines on time. So it is important that you give the medicine whenever you remember, but at least keep a gap of about 6 hours between the two dosages. So for example, if your drug dose was at 8 o'clock, which you forgot, and you remembered it just at 3 o'clock, so you can just shift the evening dose timing by about 1 to 2 hours, and then continue with the same dosage at the same timing for the next day. You can put in alarms during the initial days, so that you don't miss on any dosages. So 1 or 2 doses, half an hour here and there, would not cause a problem, but multiple missed dosages can lead to seizure recurrence or precipitations. So it is very important that you adhere to the timing of the anti-epileptic medications, especially in current scenario when we were in the COVID pandemic rather, and we are starting our schools hopefully in the coming month or coming week. So you have to adjust the timing so that you are able to give it before the child leaves for school, if it is a small child. So it is very important. Again, sometimes parents ask that the child has vomited the dose, so what should we do? So the dose should be repeated if the child vomits within first half an hour of the drug dosage administration. If it is after half an hour, you will not repeat the dose. Next slide, please, ma'am. Again, very important is that regular follow-up with the treating physician, as Dr. Saurabh already mentioned, that we always start with the lowest efficacious dose for the particular drug, and it will have to be titrated in case the seizure control is not good. Many times parents do come that our child is down with fever, infection, so there are a lot of medications. What should we do? Should we stop this drug? Are there any interactions? So it is very important to continue the seizure medications during illnesses, because in epilepsy or any seizure disorder, the child is more prone for having seizures while he is during an infection or during a febrile illness. So the drugs should not be stopped during this thing. Again, some parents ask that should I vaccinate the child while the child is on on epilepsy treatment or medications. So it is advisable to continue with all routine vaccinations, especially in febrile seizures or in epilepsy. We do consider substituting a few vaccines like DPT with acellular pertussis, which have less chances of seizures, except in special situations, like if the child, sometimes we do treat the children with steroids or ACTH. So while the child is on these medications, we advise to temporarily withhold the vaccination. Otherwise, the vaccination should be continued. You should always discuss the important side effects of your anti-epileptic medications with the doctor, so that you can look for these side effects. So sometimes some drugs have side effect of rash, which can increase, or which can be fatal if not picked up early. So it is advisable that you check the child's body while you're giving a bath, if it is a young child, or ask the child if he has any itching or rashes, or check the oral cavity for any of the side effects. Likewise, the school should be adequately informed about your child's disorder, and the first aid that should be given during, if a seizure occurs. And there is no stigma and no need for hiding this thing from the school, because timely first aid is life, and I cannot more on it. And drugs should not be stopped without consulting your doctor.
So, the that was a lot of information on what precautions should be taken while giving anti-epileptic drugs. But are any other measures useful in preventing seizures? And what can the parents be careful about to prevent seizures from occurring?
Correct. So sleep is very important in children, and especially in children with epilepsy. So adequate sleep of about 8 to 10 hours is very important. Lack of sleep or fatigue can precipitate the seizures. So if the child, for some reason, if have not slept well, make sure that you nap him in the afternoon. During the febrile illnesses, sometimes there are precipitation of seizures. So in children who have tendency of precipitation of seizures during the illness, we can sometimes give bridge courses of medications which can prevent seizures during that illness. Again, taking medicine at advice by your neurologist is very important. Always keep a list of drug, as I have discussed earlier also, and also share it with your pediatrician, so that during any concurrent illness, if there are any other drugs or medications prescribed for that, your doctor knows the drug interactions and what dose your child is taking, so that he is able to adjust the dose of the drug, or refer you or consult your neurologist for opinions regarding increasing or decreasing the particular dose of drug or side effect, or note for any particular side effect during the use of concurrent medications with other epilepsy medications. Again, some children with, especially with focal epilepsies or photosensitive epilepsies, can have epilepsy triggered by flickering light or flashes of light. So if the EEG shows abnormal discharges on flashes of light, or if the child has this problem, it is better to avoid these conditions. Epilepsy badge. So epilepsy badge is something which your child, especially if the child is, older children who are unsupervised, they should be having this epilepsy badge with them, with the name, age, blood group, the emergency contact number, emergency medicine, and the doctor's contact, so that your child, in case if he needs, he can get timely help. And the time is brain epilepsy, so it is very important for us to maintain an epilepsy badge and give that relevant information so that the child can get help.
Well, thank you, Dr. Rafat. That was very useful information, lot of precautions, and I'm sure the parents will be greatly benefited by this information. Now, many of these children with epilepsy have difficulties. They are on medications, there are side effects of medications, they may have other problems as well. So, I request Dr. Satinder Walia to throw some light into what are the schooling and educational needs for children with epilepsy. Are these different from other children? And what do parents need to know?
So after having all the medical information, I think many times parents get so engrossed in the medical information, the life has to move on, and so has the education, learning, and the schooling aspects. So as a parent, I need to be aware of some of the rights I have with a child with epilepsy. Basically, many times parents just feel that because the child is young, so maybe we can wait on to the learning, we can wait on to the other sending them to school. But as we see that now more and more children are mainstreamed, and children should go to school for learning, and no child can deny no school can deny admission for any child with epilepsy to give them admission. So there are Rights of Person with Disabilities Act. According to that, the right of education says that all children, irrespective of their disability or irrespective of their medical condition, need to go to school, and no school can deny admission. Now, many times parents ask whether we should inform the school or not. As all the doctors have already spoken about it, that the schools should be made aware, the epilepsy disclosure should be done, so that anytime if there is any emergency, school is aware of what to do and how to take care of the condition. All children should be in the mainstream classroom. The schools should have an inclusive setup. This is a part of the law, a Person with Disabilities Act. So children, whatever their needs are, if they need certain accommodations like extra time, or if their reading difficulties are there, so there are schools who are able to give support, like they can be a reader, they can be extra time. So all those provisions and modifications can be done. Schools needs to be sensitized, because many times most schools are aware that they cannot deny admission and they have to let the children come in. But as a parent, we can advocate for children. And so many times the questions are asked about the school activities and participation. Again, I think that question has to be answered by a doctor. If a child is allowed for certain activities and participation, many times parents don't like to send their children to the field trip, or they don't like to do that. I think you can be a person who can be a coach, or who can go around. You can ask the school if you want to come along with the child. And most schools with one-on-one person coming with the activities, they allow that. So the idea is the children should go and they should be with the other peer groups, and they should be learning in the mainstream classroom.
So these children with epilepsy, do they have any behavior problems? And if yes, then what do parents need to know about these behaviors in addition to all this knowledge about epilepsy? Can you tell us something about that?
So many times we've noticed that children who have epilepsy also tend to have some other behavior problems, and many times they also have developmental lags. So developmental lags are basically when a child is not able to meet their milestone at what age they are supposed to do. For example, walking at 12 months, talking at around 1.5 months. So if children are not able to meet their developmental milestones and showing developmental lags, that should be addressed along with it, along with the epilepsy. So parents can monitor their development. They can seek help at the right time. If parents see the child is able to smart, they're able to do a lot of daily activities. However, they are not able to read and write as what is expected from the grade level, then that should be a red flag that why my child is not able to learn as expected. And otherwise, they are able to do a lot of other activities, and they are similar in their knowledge and understanding of other things and their adaptive skills like other children. But if their learning is discrepant, then they can definitely seek help at an early age, and we can help them provide remedial tutoring or some support so that their learning does not get impacted. If a child is having any forms of frustration, or many times they also have low self-esteem, many times with these diagnoses of the older children, they start feeling bad about it. So a lot of counseling along with it, and parents' knowledge, a support from the community can be taken. If a child is getting bullied in a school, and many children are not able to report that, but if a child is getting frustrated and saying, I don't want to go back to school, that can be again a red flag that there is some emotional difficulties. Social skills difficulties, not able to make friends in the peer group, having difficulty making relationships in the older adult age, not able to get married. These are all social skill difficulties which can happen along with the epilepsy. Many children also shows some kind of impulsivities. They also shows many behavior changes, defines behavior. And if there are again academic and achievement difficulties, these are all red flags which needs to be addressed along with the epilepsy with the support of other professionals in the field.
So, Satinder, can you please tell us whether children with epilepsy have some learning difficulties as well? Does epilepsy per se impact learning or affect behavior in these children?
So yes, many times it is seen that there is a comorbidity of learning difficulties and learning disabilities. Many children, and the research has shown that they have difficulty in their short-term memory. They have difficulty in the visual speed, which is like finishing the work on time, copying the work from the blackboard. Their attention and concentration get impacted, which automatically impacts their learning behaviors. There can be other related conditions. For example, they might have trouble, again, the social problems, getting bullied, or low self-esteem, as we said, that may cause other emotional problems like anxiety and sometimes a form of depression as well. However, as we said, I think ma'am is going to talk more in the later slides, that epilepsy is not considered a disability right now. So many times, if there is a comorbid condition and there are additional problems like learning disability, or if they have ADHD or they have other problems, so supports under the special needs program in the school can be given to the children. A lot of accommodations and arrangements, like a help from a special educator, curriculum getting modified, accommodations in the form of getting calculator for math. If the child is not writing, a scribe can be given. If a child's speed is slow, then extra time can be provided. So all these accommodations are allowed by all the boards, whether it is the national boards, state boards, or is it the international schools. So parents, if they feel that the child needs those accommodations, should get their children assessed for other learning challenges.
Thank you, Dr. Satinder, for giving us this window into behavioral learning and school issues in children with epilepsy. So now we move on to some problems related to school-going children. So when a child is going to school, what are the instructions for the parents and the school when a child with epilepsy is sent to school? Dr. Rajni, I'll request you to take this question.
Yes, ma'am. So instructions for school-going children, the first and the foremost is that inform the school. As Dr. Satinder has already told, that we have to inform the school about the illness, and it's not a good idea to hide it because they are the ones who can take care of the emergency situation. The other important thing is midazolam nasal spray. Sometimes parents ask that, can we keep it in the child bag so that every time it is present near the child? But that is not a good idea, because children can just play around with it. So the better thing is to keep that drug available with the proper card which says that so and so much of doses has to be given, with the teacher itself in the classroom or in the sick room as per the school's policy. And it should not be strictly in the child's bag.
So typically the anti-seizure medications are going to be continued for 2 years or maybe 3 years. So should all the children with epilepsy be restrained from all activities for this period? What do you think?
No, that is not correct, because when we talk about epilepsy, we talk about two terms. One is controlled epilepsy, and the other one is that the child still has ongoing seizures, and they need a very regular follow-up or change in medication. So if I say controlled epilepsy, that means the child is seizure-free for about 1 year, and they are allowed to to participate in all the school activities, but under supervision. So they can even go for outdoor trips, as said by Mrs. Satinder, that the parents can accompany them. They can even go for cycling, the contact sports, which we say that they are not allowed to. They are even allowed that. They're even allowed swimming, but under supervision. Sometimes the school have a system which is called a buddy system, in which you can ask one of their classmates or friend to keep an eye or to have some kind of extra supervision on that child during these activities in the playground, or while they are doing any other extracurricular activities. So that kind of system can be formed in the school. One restriction is about photosensitive epilepsies. In some epilepsies, the flickering light precipitates epilepsy. So flickering lights are expected in discos, pubs, and some kind of intensive video games, in which there is you usually get a disclaimer that the children who have epilepsy should not participate in these games. So better to avoid these kind of video games or these areas where child do not feel comfortable in the presence of flickering light. So this is a specific kind of restriction for specific epilepsy, specific group of children who has this kind of epilepsy.
Thank you, Dr. Rajni. So these children with epilepsies, they belong to a family. And in some sense, the whole family can be affected because of the medications, the special situations that the child with epilepsy is going through. So, uh, Satinder, can you tell us what kind of family and psychosocial problems do these children face? And how stressful is it? And what do the parents go through?
So, as we know that epilepsy is a kind of a chronic illness, and it is something which impacts not only a person who is going through it, but it also impacts the whole family. In fact, the siblings, parents, everybody gets impacted with that. So it is a public health problem, which is pretty common. And if we don't talk about it, it doesn't mean it doesn't happen. It's just that we need to get into a habit of talking about it and making a parent supports group so that we can sensitize the whole society about it and the community about it. It can be very challenging as we are hearing that what all needs to be done, and it would require immediate attention, and it can be complex in nature because there is no one type and no one treatment which can be followed. So basically, in order to deal with these kind of issues, we need people with epilepsy the skills. That means as they grow older, this is not going to go away. So they need to know how to manage their condition. So more sensitization happens, like the epilepsy badge is shown. So the children would know themselves how to utilize that and tell the people around them that whether and what needs to be done and how to seek help. Access to specialty care, the more awareness will happen, and then the children are in the mainstream, then we need to be we need to make sure that the access to specialty care, that's why letting the schools aware about this is very important, and more awareness about the informed public, so that many times there are myths in the community ki daure padte hain, we use very negative words, and we also are not a very disability friendly. So if we start seeing more people with different needs in the community, and sooner the children see in the school settings, the more aware they become about it, and it is easier for them to accept children with different needs. So epilepsy can lead to many family difficulties, in the sense that parents have to go for a lot of medical visits. It puts emotional burden, it puts physical burden, because if you are the only primary caretaker, it also leads to economical burden. There can be increased stress because you're dealing with something which you don't know, and it can be very stressful to take care of somebody who's medical ill in the family. It also impacts relationships because you are so engrossed taking care, and many times parents get so involved taking care of one child that the siblings gets neglected. So it does put various kinds of pressure on the family. It can lead to social problems again. If we are not aware, we are not sensitized, then we tend to use different stigmas around any disability or even with epilepsy. So it can lead to negative attitude, children can be isolated, there could be inadequate knowledge, and then if we are not aware about the situation, then there could be lack of support from the environment and the immediate support system, which could be your peer group and your teachers or the school. And the individual problems, as we discussed, that a person who is going through this, they might feel isolated, it might lead to poor self-esteem. Many times children who also have learning challenges, they start feeling bad because they are not able to score much marks, they get compared with other children, which can lead to more and more poor self-esteem and social isolation, stigma. And in the later years, because it will impact your the relationships, and it can impact your personal relationships and employment. So it does lead to impact your quality of life. So again, more and more knowledge about it and the awareness about the situation, how to deal with it, is going to help us more, rather than just brushing it under the carpet.
Thank you, Satinder. So, Dr. Saurabh, despite treatment, are there any dangers of epilepsy? And are there any risks? Many times parents are very scared that they might lose their child during a seizure, or if a seizure occurs during sleep, they may miss it and harm may occur to the child. So, what are the risks of epilepsy? Dr. Saurabh?
Yeah, sorry, I was on mute. So, looking at a child having seizures is quite distressing. And this is true not only for parents, but also for doctors. Even talking to some of my colleagues whose children had, at some point in their lives, had seizures, it is very clear that trained neurologists also, when they see their own child having a seizure, are very, very distressed. And the first thing that crosses most parents' mind is, I'm losing my child. Actually, but that is not really the case. Yes, there are risks involved around epilepsy, and sudden deaths in children and adults with epilepsy have been described, but the risks are relatively low. In fact, they are so low that it is much more likely that a child with epilepsy, um, if they die, they would die of other causes, that is, your routine pneumonias, diarrheas, road traffic accidents, etc. And just looking at it, do we really feel scared when we sit in a car and we are about to drive? There are risks in life in various aspects, and epilepsy is just a minor addition to it. And so, although it is minor, but we should take certain precautions to make our children with epilepsy safer. The first and foremost precaution is that the parents should give the medications to the child regularly. Can I have the next slide, please? So, giving regular medications protects children from seizures and harm. If the child continues to have seizures despite giving regular medications, going for follow-up is very important so that the doctor can actually change medication or increase the dose. Even if the child is well controlled, going for regular intermittent follow-up is helpful to have an overview of the child. Besides that, our culture usually involves sleeping in the same room as the child. And this is known to be protective because parents are less likely to miss events at night. But monitoring the child for the whole night is not really practical. Parents need to have adequate rest so that they can be functional and more useful as parents during the daytime. Staying up all night to observe the child is not at all practical and should not be attempted. In some cultures, like in the Western world, it is okay to sleep in a separate room and one should not feel guilty of doing it. In fact, in the Western countries, many parents may choose to use baby monitors. These are just audio monitors that transmit any sudden audiological changes in the child's environment to the parent's room. Finally, and probably the most important, is to learn basic care during a seizure. And Dr. Rafat has already explained it beautifully.
Well, thank you, Dr. Saurabh, and all the other resource people. No discussion on epilepsy these days can be said to be complete until and unless we also discuss and give knowledge about what the various schemes for children with epilepsy are. So, before knowing that, we should understand what a disability is. A disability is that there is limitation in interaction between a person's body and the society of which he's a part due to some impairment in some function of the body. And since many children with epilepsy are not able to perform to their full extent in the society, they can be said to have a disability. The world over, all societies understand the need to make adjustments and to provide some sort of support, which is called affirmative action for persons with disabilities. And Earlier, it used to be considered a big charity to support these people, but now it is considered a right. It is a right of people with disability to be given this support from the society. And now this is occurring in India as well. The government of India passed the Rights of Persons with Disabilities Act in 2016, and they listed 21 disabilities. And out of these, the ones in red are the ones which can sometimes be or often be associated in children who have epilepsy. They can have intellectual disability, hearing, vision problems, autism spectrum, cerebral palsy, some learning difficulties, speech and language. So, and sometimes even multiple disabilities. So if any of these are present, they can be considered to have a disability. So if you will see epilepsy in that list, epilepsy is not specifically covered, but there is a category of chronic neurological conditions under which epilepsy may be counted as a disability, especially if it is resistant to treatment with drugs. So how does one avail of these government schemes? The first step to availing different government benefits for persons with disabilities is to enroll in the UDID, or a unique ID for persons with disabilities. And this is a card which can be obtained by filling up a form on a website, and certain procedures have to be followed. This is a central government project, and once this card is made, then any sort of government scheme can be availed of by producing this card. If this is not available, at least a disability certificate has to be made. So here are some schemes for children, parents of children with epilepsy. First of all, income tax rebate. Income tax benefits are available for parents of children with epilepsy in India, but most of the times the parents don't avail it. Income tax benefit is available under Section 80DD, and this is available to individuals who take care of a disabled or differently abled dependent. The dependent could be anybody like a spouse, children, parents, brothers, sisters of the taxpayer. And the expenses incurred for medical treatment, which includes nursing, training, they all can be considered as extra expenses. However, currently these deductions are allowed irrespective of the actual expenditure. The deductions allowed are 75,000 where the disability is 40 to 80%, and 1,25,000 when the disability is more than 80%. And under the Income Tax Act, the disabilities covered here are listed here. So very often children with epilepsy have associated autism, cerebral palsy, or multiple disabilities, and therefore the parents would qualify for an income tax rebate. The requirements are that a form has to be filled by an authorized medical practitioner as prescribed under the Income Tax Act. Currently, a civil surgeon or a COO of a government hospital can fill in this form, but recently the government has approved a neurologist with a DM degree in neurology, and in case of children, a pediatric neurologist can also fill up this form. Then what about insurance for children with epilepsy? Now, this used to be a very big problem because many children with epilepsy were not able to get any insurance for them. In India, this is in general, in India, the insurance schemes available include those offered by the government of India for their employees, such as CGHS, ESIC, or the government insurance, which is for specific populations, such as those who are below poverty line, or the Ayushman Bharat, these schemes. In these, and the second group would be the group health insurance, which is the one which is given when you are employed in the corporate sector. Now, these type of policies cover all conditions and disabilities. However, what happens when when the parents are not or parents or child are not eligible for any of these insurance schemes? So this particularly is not beneficial for individuals who come from lower or middle socioeconomic status and who do not meet the above criteria. So they have to opt for healthcare cover taken at an individual level. So there are as for private cover, you can have two categories of insurance companies: the public sector, which is the New India Assurance Company, Oriental, United India, and in the private sector companies, there are the HDFC, ICI, etc. But the problem here is that these policies do not include persons with disabilities, epilepsy, and genetic disorders. So, what is to be done? So, in a very kind of a good stand, the epilepsy has become included in the list of permanent exclusions. This means that at the time of taking your insurance, you can declare that the child has epilepsy. Once that is declared, then the insurance will be given to the child, and this will cover all other things like, say, pneumonia or a fracture, anything else that happens, that will be covered. Earlier, nothing used to be covered and no insurance was given to these children. If one is not able to afford the insurance which I described earlier, some government insurance schemes are available. One of them, very good ones, is Niramaya. This is the health insurance scheme of the National Trust for Persons with Disabilities, and covers autism, cerebral palsy, mental retardation, and the multiple disabilities. It does not cover epilepsy alone. But if any of these conditions are associated, then this scheme can be availed of. It provides coverage of up to 1 lakh rupees per year for prevention and reduction of impairments, and includes both OPD and inpatient on a reimbursement basis. And the claim can be reimbursed through the TP of the Oriental Insurance Company once you have had your child registered in this scheme. The other one is called Swablamban. Here, this scheme is provided by the New India Assurance Company, and it covers very few disabilities which could be associated in children with epilepsy, such as low vision, locomotor disability, and mental retardation, or we prefer to use the term intellectual disability or developmental delay. Epilepsy alone would not be covered. Besides that, there are many other benefits. It's not possible to discuss them all, but some important ones include travel concession like bus, railways, and air. Then many educational scholarships are there. Some seats are reserved in colleges. And during exams, children with spasticity, visual impairment, physical impairments, dyslexia, etc., they can be allowed special privileges, such as they can be allowed to use a scribe or compensatory time in board examinations. And this has been discussed by Sitinder earlier. Now, who can give this certificate for use in the different boards? It's only a psychiatrist or a psychologist who is registered with the Rehabilitation Council of India. These people can issue these certificates. So these are some of the correct the links, and it would be a good idea to go through all of these and avail of whatever facilities that you can for your child. Thank you very much. I would like to thank all the resource people for giving their valuable time. And I know this information will be extremely useful for parents of children with epilepsy. Thank you all. Thank you once again.